Welcome everyone to our 2021 Broker Education Day, brought to you by Social Distancing and Hand Sanitizer. Don't worry that this won't take 2 hours. We're just going to roll through it as quickly as possible here within a half an hour. And you'll always feel free to email, call, or text the green line with any questions that you have after you watch this presentation. So let's start out here with commissions. None of the carriers have wanted to be the first to announce commissions. So what we're going to do is just kind of break it down here in this chart. Select Health, we know that their renewal and new business was $16 per member per month here in 2020. That's still pending approval for 2021, and we are unsure as to what they're going to do with their commissions. So stay tuned. We'll be getting new information out to you here within the week. So the University of Utah has in fact made their commissions final for 2021. They're moving from $17 per member per month to $18 per member per month. Cigna has also finalized their commissions on new and renewing business. New business will be $20 per member per month per adult and $10 per member per month for dependents, up to 4 dependents under the age of 18. And their renewal is 16 and 8. And that is final for 2021. Molina has still yet to finalize their 2021 commissions for new and renewing business, so stay tuned for that. In 2020, their new business was $18.75 per member per month. Regence will be on the marketplace this year, and their commissions will be $18 per member per month, and that is finalized for 2021. Bonus, same thing as commissions. There will be more information coming soon. Select Health in 2020 had their $2 per member per month bonus on renewing business. We don't know if they're going to keep that or if they're going to bring it up, what's going to happen. So stay tuned for that. The University of Utah is doing the same thing they did last year. For any renewing business, they're going to pay $60 per policy or per subscriber, not member, but per policy, which is significant. So they had to have a plan in 2020, and they need to keep it for 3 months out of 2021, and they will be paying out that bonus in April, it sounds like. Cigna, to be determined. They will have a bonus structure, but they have not yet released it for 2021. Molina, the same. They will have a bonus structure, but have not released it yet. Regence has released their enhanced commission bonus, and that is $6 per member per month on any policy, but you have to have at least 40 policies with them in order to get that. Otherwise, it's still just the $18 per member per month. Let's go into premiums real quick. Here's a beautiful chart. We won't go too much into it because it's not as significant when subsidies are playing a part. So as you can see, Select Health went down a lot. University of Utah went up about 3% across the board. Molina went down on the majority of their plans. They went up in some of their bronze, and Cigna went up on most of their plans as well. So that's going to affect benchmark plans. So each county will have a lower benchmark plan this year. Lower benchmark plans means lower subsidy or lower APTC. So check out this chart. As you can see, there's going to be some significant counties in which benchmark plan premiums are going to go down 10%. So Box Elder, Morgan, there's going to be some significant change there in Wasatch counties, Summit counties, and quite a few others. So keep an eye out for that. For example, Joe lives in Morgan County. In 2020, he received a tax credit of $1,000. So the benchmark plan went down in Morgan County 10%. So in 2021, he will expect to get a tax credit of $900. So it's a significant difference there. We've seen the Medicaid expansion hit. That started in July of 2020. The Medicaid eligibility is increased to 138% of the federal poverty line. So please be aware of this change. And so we will update this on our placemat as well, but higher income equals lower tax credits. So for example, Joe makes just enough money to not qualify for Medicaid. In 2020, he made $13,500 and got a tax credit. In 2021, if he made the same amount, he would be sent to Medicaid and receive no tax credit. So a big thing to note here is that auto renewals will also be sent to Medicaid. So in this case, if you let Joe auto re-enroll, he's going to get sent to Medicaid. You just need to be aware of that.
You're also going to have clients that are below that 138% that are going to be sent to Medicaid. Here's the thing though, is Medicaid and the marketplace use two completely different formulas for eligibility determination. Just because somebody has income below 138% of the federal poverty line is not a guarantee that they are going to get on Medicaid. They very well could be rejected for a number of reasons. You can keep clients on the marketplace below 138% federal poverty line. If they're rejected by Medicaid, instead of upping their income to 141% FBL, you just go through the application, you would state that they were denied Medicaid, you'll enter the date they were denied Medicaid, and then just put in their income at that limit. So in this case, Joe makes the 13.5, he might get sent to Medicaid, he might get rejected by Medicaid, then you go back, put him on the marketplace at 13.5, and you just got to put that he was denied Medicaid and enter the date that he was denied.
All right, perfect, thank you.
Okay, other changes. So max out-of-pockets are going to $85.50 for individual and $17,100 for families. You'll also notice, if you've done an application recently, there's about 8 or 9 pages regarding HRAs. Now, most of your clients are not going to be offered an HRA. So if you come across a client that is offered an HRA and you forget what we're about to discuss, just call or text the green line, we'll walk you through it. The two that the marketplace are concerned about are the individual coverage HRA and the qualified small employer HRA, which I'm just going to call an ICHRA and a QSERA. The ICHRA, your client can opt out of it and get a subsidy, but only if the HRA fails the affordability test. So just like you would with employer-based coverage, you have to submit it to the affordability test. If it's deemed unaffordable, then they can go get a subsidy. The ICHRA follows that same logic, that same process. The QSERA, on the other hand, they can take that HRA and the subsidy, but they have to offset the subsidy by however much the HRA is. So at the end of the application, when it says, hey, do you want to use all of the tax credit? You would say no, and then just manually adjust it. So 90% of the time, if your client has the ICHRA, it's probably not going to fail the affordability test. They probably should just take the ICHRA. If they have the QSERA, you just have to offset the subsidy.
So let's quickly dive into carriers. We're going to go into every single carrier specifically and highlight them and what they're offering and what they're not offering. So let's just start with Select Health, the Champ. They are expanding value into 4 new counties. This is significant. Box Elder, Morgan, Summit, and Wasatch County. If you remember the previous slide that showed where the benchmark plan was going in down 10%, coincidentally, Box Elder, Morgan, Summit, and Wasatch all had a significant decrease in the benchmark plan premium. So these 4 new counties are really going to have some extra work involved. So if you have clients in these counties, keep in mind value will be in those counties, not just med. Hospital networks, there's been no changes to hospital networks. They have made some changes on plans. Let's go over the benchmark plans as we've seen last year. Remember, they have some limits on what they cover. We have that in your quoting tool. We have it on your placemat, so you have reference for that. Let's remember that there is no pediatric dental on those plans. We had some questions throughout the year where agents would call and say, hey, I didn't realize this didn't have pediatric dental. Benchmark plans do not have pediatric dental embedded. So But because they are benchmark plans, they are 100% EHB and zero premium eligible plans. So you'll see some bronze plans that actually are able to have a zero premium. The Health Save 3250, that plan, I don't think a lot of people sold it, and that's probably why they're getting rid of it. But Select Health is getting rid of the Health Save 3250, and that plan will be crosswalked to the Silver 2500. Keep in mind that this is not an HSA plan. So anyone who was on the 3250 and had an HSA will get crosswalked to a Silver 2500 and not have an HSA. So this is another reason why we shouldn't be auto re-enrolling clients or allowing them to do so. There's some significant changes. The Silver 4000 copay is another plan that Select Health's getting rid of. That will be crosswalked to the Silver 3000. I want to make a quick note on all Select Health HSA plans. They have non-embedded deductibles. It's always been this way, but we get questions throughout the year. Non-embedded deductible means that if they have more than one person on their HSA plan, they do not have an individual deductible anymore. It's gone. It's actually a family deductible. But keep in mind, they do have an individual max out of pocket on these plans as well. So just make sure that we're educated on that and educating our clients. Premiums. They went down 2% overall, which is great. Off-market silver that they have is 20% cheaper than the on-exchange equivalent. That's great because if they're unsubsidized, they can just go directly to Select Health's website. They can enroll there on their off-marketplace silver plan, and then they'll get a 20% discount on it. Commissions we talked about earlier, to be determined still. We know what they were for 2020, but not for 2021. Highlights here. All of their virtual visits free on every single one of their plans, including their HSA plans. So if you remember last year, if you had an HSA plan, you had virtual visits embedded in there, but it was a $49 copay. This year, it's zero. There is no copay. Free virtual visits on all plans. That's pretty cool. Wellness rewards are still going to be there for the gym reimbursement and whatnot. There's a wellness reward of up to $240 for a single person and $580 for the family. We'll talk about the University of Utah. As you saw, rates went up a little bit there, so we wish that they would come back to us. Everyone loves the U. We love the U. They did expand county. They added their preferred network in Tooele County. And because of that, they have also added Mountain West Hospital in Tooele is now on the preferred network as well. So all of their plans are 100% EHB, zero premium eligible plans, which is really nice. You'll see some of those zero premium bronze plans in the mix. They do have a new silver plan called the 2300 plan. The Silver 2300, I think that's what Select Health called their silver plan last year, but finders
sold a lot of those last year.
Finders, keepers, losers, weepers, I guess. Their bronze HSA of note is the only non-Select Health HSA on the exchange. So if they don't want Select Health and they want an HSA, they can only get that through the University of Utah. As we talked about, their premiums increased 3% across the board, which kind of is pricing them out of the market this year. There's no point in crying over spilled milk, I guess, but makes us sad just as well. So their commissions have raised from $17 to $18 per member per month, which is nice. $60 per renewed policy bonus, which is great. Carrier highlights: they are zero. They have $0 virtual visits and MD Live, except for on their HSA plans. They still have that $49 copay. They do look great in red, and their underwriter may work for Select Health. Let's talk about Cigna. They had a good year. Their freshman year was good in 2020. Their sophomore year is upon us. They have no changes in counties or networks. All of their plans are 100% EHB, zero premium eligible plans. The Silver 3500 diabetes plan of note this year. If you remembered last year, their tier 3 insulins were $25 copays. They've since expanded on that, and they've created a diabetes plan, which includes the 3 tier 3 insulin $25 copays, and $0 for diabetes supplies on the Cigna drug list. They're also including select labs and exams for free. So really, if anyone has diabetes, they should be on this plan if it's available in their county. They will save thousands of dollars on their medications, labs, exams, and supplies. Our premiums on the bronze side of things went up about 10%, and silver went up about 2%. They will still be very competitive on the Wasatch front, so please keep an eye on that. Commissions, they have finalized. New is $20 per member per month per adult, $10 per member per month per child under 18, and they will go up to 4 children on that, where other carriers will only do 3. So renewals will be $16 per member per month per adult and $8 per member per month per child under 18. Their bonus, they have not announced it yet. Last year it was up to $60 per member per month for new policies in 2020. So they have some other thresholds. I think that was if you had 500 policies, but they have some easy to meet thresholds and a great bonus structure in 2020. So we're hoping to see the same thing in 2021. Carrier highlights: $0 copay for all virtual care on all of their plans because they don't have any HSA plans. Of note, that includes behavioral health. As we all sit here with COVID and we are spending more time with our thoughts and ourselves and our families, people seem to be going a little more crazy than usual. And so behavioral health has become a big thing in the virtual care world. And Cigna has the only virtual care that includes behavioral health on the marketplace. They did remove their referral requirement, which was nice. So you don't need a referral to see a specialist anymore. And then, like we talked about earlier, the diabetes plan. Let's just keep an eye on that. It'll be a great option for diabetic clients. Regence. They will be on the marketplace in 2021, so they have a new network. I shouldn't say new network, it's the same network, but everything is new for 2021. All new plans. None of their plans are 100% EHB or zero premium eligible plans, which kind of stinks, but just keep that in mind. Premiums are all new for 2021. Commissions we talked about earlier, they're $18 per member per month. This is not required at all whatsoever, but if you don't believe that you're going to hit 40 policies, which we're not going to really see, I feel like not many agents are going to hit 40 policies with Regence this year. So what we're doing is, if you do want to enhance your commissions, what we can do is you can write under Health First. Obviously, you're still independent. You'll still own your book. But if we write it under Health First, we'll hit the 40 policies and we will split that bonus with you guys. And so you would collect $21 per member per month, even if you only wrote 5 policies. And then also, if you do, in fact, as an individual agent, hit 40 policies, then Health First will pay you out the full $24 per member per month. So once again, not required, but a good way to make some extra money if you do sell any Regence plans. This is the moment that we've been waiting for, but Molina, not the hero we wanted, but the hero we need. David told me I was supposed to do a Batman voice on that, but my Batman voice isn't good. So, counties. Molina is not in any new counties this year. Their hospital network has changed significantly. They've added the University of Utah hospital systems, all clinics, all hospitals, and their physicians, and that started September 1st of this year. So that is a huge deal. Molina has over 13,500 providers across the state, by far the largest network in the state of Utah. It destroys SelectMed. So we'll talk about that a little bit later. Their plans. All of their plans are 100% EHB, zero premium eligible plans, except for the ones that include adult vision. So So that's great news. They have a Core Care Bronze 4 plan of note, which is a 0 deductible bronze plan. I say again, the Core Care Bronze 4 is a 0 deductible bronze plan. This is huge. This is a huge deal. The $30 PCP copay, $30 urgent care copay, $90 specialist copay. There's a $1,500 inpatient per day copay, 2-day limit, meaning if you were hospitalized for 20 days, you would only pay $3,000, $1,500 copay times 2. You'd pay $3,000 for your stay. You wouldn't even have to hit your max out of pocket. Let's say you go home and 2 days later you have to come back to the hospital. You will have to meet your 2-day copay limit again. So another $3,000 for that. So this is a huge plan. It's going to be eligible for a 0 premium as well. So the subsidy may eat up the full cost of this. So at times, I'm sure you have sent your client a silver plan with a 0 deductible, for $50, $60 a month, and then you sent them a 0 premium bronze plan with an $8,000 deductible, and they were trying to figure out which one they were going to choose. Molina has made that silver and bronze plan. They brought them together and they had a baby, and that is the Core Care Bronze 4 with a 0 deductible. So very, very significant. Their Constant Care Silver 1 plan will be a 0 deductible silver plan on standard cost sharing. So even if they don't get any cost sharing, if they're not in the 94% cost sharing or in any cost sharing level at all, they will still have a 0 deductible if they so choose. It does have very similar copays to the bronze plan, a slightly cheaper specialist of $60 and a slightly cheaper inpatient hospitalization copay. So they are also coming out. Well, they have a gold plan, and as you saw in the previous slide, how they went down about 27% on their gold plan, which we didn't really think anything of until we looked at the quoting tool. They are going to have a gold plan that has a lower premium than their silver plans. And this plan is going to have a $6,500 max out of pocket. So this gold plan, if you have unsubsidized clients, has a significant max out of pocket and will be cheaper than the silver plans. So this is a great play for Molina. Their urgent care copay on every single one of their plans is the same as their primary care physician copay, so also significant. Premiums we saw, bronze plans go down about 2.5%, silvers went up a little bit, and silver went down 3.2%, the bronze went up 2.5%, and then their gold plan went down 24.7%. So commissions, we don't know what they are for 2021. They were $18.75 per member per month. We've been assured that it's not going down any, so just stay tuned for that. The bonus also last year was $25 per member for 25 plus lives. So a very easy threshold to hit in 2020. We'll see what they pull together for 2021. They also said that was going to be a significant bonus. Carrier highlights. So this is where I'm going to try to put everyone's mind at ease when it comes to Molina. I know they left 3 or 4 years ago. They left because Trump pulled cost-sharing reductions, the subsidies that went to the insurance companies, and that's the year that we saw the silver loading and whatnot. Well, each carrier came up with 2 different rates for the most part, and they said one with cost-sharing reductions, one without, and Molina only had it with the cost-sharing subsidies. So as soon as Trump made that ruling that they were not going to have those cost-sharing subsidies, Molina just felt like they were going to be so uncompetitive on their rates that they had to pull out. Keep in mind that if you pull out as an insurance company out of the marketplace, the Department of Insurance will not allow you to come back for 4 years. The Department of Insurance allowed Molina to come back that next year because they understood and they knew why they left, and they knew it was no fault of their own. Unfortunately, because they left the market, there was some significant communications, billing, and claims issues. And so since then, we have been meeting for the last few years with Molina. We've been meeting with their plan president, their head of broker relations, underwriting team, that kind of stuff. And we've said, hey, there are some significant issues that need to be addressed, one of which was customer service. So they've spent the last few years really buckling down on their training for their customer service team and broker relations team. They've brought back the Molina care team. That would be option 2 on their broker support line, and that team is dedicated to escalating marketplace issues. Right, so if you saw one of your clients lose subsidy or their plan was terminated for no reason, and you call the marketplace and they say, sorry, you need to call the insurance company, and the insurance company says, sorry, you need to call the marketplace, and now your client's in the middle of it, the Molina care team actually will reach out to the marketplace, escalate the issue on their end. They will figure it out between them, and then they will notify the client and the agent. So it takes a huge load off of you as the agent and your consumer and the client as well. We've talked about their improved customer service. Network adequacy was another one that we really harped on. We said, hey, you guys need to have a network. It can't be a garbage network. Obviously, they've addressed that, and now they have a monster network. And they're going to have the University of Utah, Huntsman Cancer Institute. It's going to be a really large network. And they're going to have a zero deductible bronze plan. So those are the carrier highlights. We're hoping that the issues that we have brought to Molina's attention have been addressed. There was one other that I wanted to bring up, was their website and their doctor, their Find a Doctor. It was terrible. It still is. It's something that they are aware of. They will be unable to make the change for 2021, but what they've given us instead is their full network data. All of their hospitals, all of their clinics, all of the physicians, specialists, primary care, everything. And so we are actually in the process, we've received that information from Select Health as well. So we are in the process of trying to create our own provider search. You will at least have a Molina Select Health provider search where you'll be able to type in a doctor's name, a hospital's name, and it will pull up with the carrier and network that they are with. So
I just wanted to pop in real quick on this network adequacy. So like Brandon mentioned, we have the data from Molina and Select Health, and Molina by far has the larger network. One of the things we did though was we did a county by county comparison between what Molina had, what Select Health had, and what was shared. And what we found is in most counties, pound for pound, Molina has a higher exclusive network and has the majority, even with what's shared. And so Molina, statewide, but even county by county, is going to have more primary care physicians and more specialists in each county.
Moving on. Let's go into National General. We'll first talk about their accident medical enhancer, their plan supplement, and then we'll talk about short-term plans. So, I want to real quick say that if you don't understand National General and their supplements and short-term plans, you should get to know them, because this will be a huge year for National General supplements. With Molina having a zero deductible plan, adding on supplements, I mean, it may even be a zero premium plan, and then adding on supplements to fill in gaps is really going to help your client, and it's really going to, it can in fact double your commissions. So If you're not sure as to how to use it, let's get familiar with it, because it's been really big over the last few years and it's just about to get much bigger. And if you're not quoting this out, or if you're not talking to your client about it, other agents will talk to your client about it. Rest assured. So let's talk about their benefit levels. They have 15 different benefit levels, from $2,500 to $17,500. There is an 85/50 option in 2021 to match the ACA maximum out of pocket. This accident medical enhancer does not coordinate with insurance. It simply pays based on the claim. So I'll give you a quick example. If someone goes and breaks their leg and they have this accident medical enhancer, and it costs them $4,000 to fix their broken leg, their benefit amount was an 85/50 option to match their ACA max out of pocket. They would have a $250 deductible taken out of their benefit payment, and they would receive $3,750 because their claim was $4,000. Okay. Now, there are two riders that we typically attach to the standard accident medical enhancer. The first of which is the cancer, heart attack, and stroke rider. The second is the sickness hospitalization rider. So we'll just refer to them as CHS and sickness. The CHS rider has a pre-existing condition limitation. It is only available for those that are 18 to 64 years of age, so there's no over 65 rider on this, and there is no child-only rider on this. They will pay out the full benefit amount of $85.50 or whatever benefit amount they choose, minus their $250 deductible. They will pay out the full amount for the first ever diagnosis of cancer. Keep in mind there's a 30-day waiting period for cancer, and there is a 30-day waiting period for heart attack and stroke. The sickness hospitalization rider also has a pre-existing condition limitation. It's a 12-month look back from the effective date of the plan. There's also a 30-day waiting period from the effective date of the plan. And the reason for these look backs and waiting periods is they really don't want people committing fraud or even being tempted to, right? And so if there's a 30-day waiting period, they don't have to worry about somebody getting sick or feeling like they may have pneumonia and then going and getting an accident medical plan with the sickness hospitalization rider and then going in 3 days later to be diagnosed with pneumonia and be hospitalized for a week and then getting their benefit amount. So just keep that in mind. And they'll also do a 12-month look-back period from the effective date on all of these plans. They won't do it right when you do the application, but they will do it if you file a claim. So the sickness hospitalization rider also has one benefit per year and two for the family. So commissions on these plans are 47% of premium for the first year. The second year, I think you actually have to pay them. No, I'm just kidding. It goes down to hardly anything. So we're seeing a lot of people, a lot of agents actually rewriting these plans every year to match the ACA maximum out-of-pocket limit for that year. So last year it was an $8,150 plan. This year it's an $8,550 plan. Maybe in 2022 it's a $9,000 plan. Just keep in mind that will actually reset their 30-day waiting period. So they may not really like that. But as long as you educate them on the 30-day waiting period from the effective date, and that should be fine. National General short-term plans. These were huge over the last few years. They are a great alternative for healthy families and individuals that are unsubsidized on the marketplace. Keep in mind, these are not ACA qualified plans. I say again, they're not qualified ACA plans. They don't cover all the 10 essential health benefits. They have annual maximums, lifetime maximums, stuff like that. So please don't sell them as ACA plans. They are not. It's also a great alternative for Christian car sharing ministries, which are not regulated by the Department of Insurance. A lot of agents come to us asking about Christian car sharing ministries. It is not something we are able to condone as a general agency because they're not insurance and they're not regulated by the DOI. So these are great alternatives to those. The short-term plans are in all counties. In fact, they're in a ton of states. So any state that you actually are licensed in, they will pull it from the NIPR database, and they will actually include all of those states and all of the plans that are available in those states in your quoting tool and in your broker back office. So their hospital networks, they have 2 hospital networks. One is the Aetna PPO and one is the Cigna PPO. Keep in mind, these are very, very similar networks, so actually only a 0.3% difference in premium. So we're only going to quote out the Aetna PPO, which is the more expensive one, on your quoting tool, just to make things easier and cleaner. But if they are concerned at all whatsoever, both PPOs have most IHC and non-IHC hospital systems and doctors included, so it's a really, really comprehensive network. If they're concerned, they can still look up their providers on each network. They have 16 different plan options with deductibles ranging from $2,500 up to $25,000. Co-insurance options all over the place. Some plans have copays and prescription coverage even. Those are called copay enhanced plans. They also have 2 guaranteed issue plans, which is nice. So if they go through the 10 simplified underwriting questions and they fail, you can actually go back and rewrite the application for one of their guaranteed issue plans. Like I said earlier, these plans do have annual maximums and lifetime limits, and they vary by plan. Their commissions are 18% for one-year plans and 22% of premium for renewable plans. So you can get a plan for 1 month, 2 months, 3 months, 6 months, a year, 2 years, 3 years. Really, really flexible on that kind of stuff. What I would suggest doing is keeping premium lower. Obviously, if you get a 3-year guaranteed renewable plan, it's much more expensive than a 1-year plan. And because we have this beautiful thing called the ACA with no pre-existing conditions on the back burner, I would suggest writing a 1-year short-term plan with an effective date of January 1st, but writing the application in December. If we write it in December and they fail any of this and they don't want the guaranteed issue plan, you can get them on an ACA plan because we're still during open enrollment. So just keep that in mind. Carrier highlights. They changed some things this year. They put in some significant discounts. A 12% discount for prior medical coverage and another 20% discount on top of that for preferred underwriting. So if you decide to answer these preferred underwriting questions, you can get another 20%. So I'll read off the preferred qualifications for the underwriting. Has any adult applicant used tobacco or nicotine in the last year? Have all adult applicants had other major medical health insurance, including short-term, for at least 9 months within the last 12 months? So, does any adult applicant lease or own a motorcycle? Does any adult applicant have any citations for DWI or DUI or more than one moving violation, including speeding tickets within the last 2 years? Within the last 5 years, has any adult application received medical treatment or has medication been prescribed or recommended for the following? High blood pressure, high cholesterol, anxiety, or depression. Also, each member must meet the following build requirements to qualify for the preferred rating. Males must be equal to or less than 240 pounds, and females must be equal to or less than 190 pounds. So if they answer all those questions correctly, they get another 20%. Keep in mind that you cannot lie about these things because National General will go back at the time you submit a claim and they will look back and they will ask for proof of coverage in the last 12 months, that kind of stuff. So they will really dig. And there's nothing that these companies hate more than fraudulent claims. So in the past, agents have asked me about dental insurance, and I've always said you probably have a better bet getting a discount plan with your dentist. And until now, I found a dental company that we are contracted with now, and I think this is going to be a good year. It's one of those things that we can actually throw on every quote, and this with Best One Dental. They have no deductible. They cover implants on their choice plans. There's a $25 copay for each visit, keep in mind. There's no waiting period on the choice plans, but the benefits are reduced first year, and we'll kind of get into that a little bit. They have a nationwide network. They have the Dentamax network, which is a massive network, and then they also fill in some of the gaps with the Connection Dental network. So it was difficult for us to see how many providers they had in Utah, but we were able to see within 60 miles of West Jordan, where our office is located, there are 3,600 dentists. So it's a huge network. They'll give you a personalized link, which we will actually embed in your quoting tool, so that you can quote dental on each plan, and if they want it, they can click on it and they can sign up for it very easy, and it's linked to you as the agent. The one negative that I did find was that a simple tooth extraction is considered a major service with Best One Dental. So get your own pliers and do it yourself, is what we're saying. I'm just kidding. But our job is to find the goods and the bads and the uglies, and so this is one of the bads, but there's way more pros than cons on this one. So here are the rates. As you can see, they have 3 different plans: an economy plan, a choice plan, and 2 choice plans. The difference between the 2 choice plans is literally only the annual maximum. As you can see, they have a $3,000 or a $5,000 annual maximum on those choice plans, which is huge. The economy plan is a $1,500 annual maximum, but is compared to your standard dental select or EMI plan. And you can see down there for the economy plan is dirt cheap for a family. It's $45 a month. You can see on the choice plan, the $3,000 and the $5,000 annual maximum. We don't see many people buying the $3,000 annual maximum because it's only about $5 or $6 more expensive to have a $5,000 annual maximum. So $5,000 annual maximum is pretty much an unlimited benefit. You don't really see anyone hitting $5,000 in dental work throughout the year. So it's a significant annual maximum. So we are loving this product. Commissions on this plan are 20% the first year and then 10% ongoing. So very similar to the other carriers, except for they're going to give us a bonus that first year of 10%. So what to do next? I'll have David go over this with everyone. But
okay. Open enrollment dates, obviously November 1st to December 15th, coming up on us pretty quick. And we are trying to hustle out everything to you as soon as we can. So window shopping is coming up. We're going to talk about some marketing materials that we put together. We're going to talk about the placemat and the green line. So first things first, window shopping is coming soon. Dan expects this to be live this coming Monday. Email with instructions are going to be sent out, and we are going to be updating and changing the tool a little bit. You'll see that Best One Dental added in for quoting dental, and then the link will go out as a part of the quote so that your clients can go straight to the website and enroll themselves. It's pretty simple, and it'll be linked to you as the agent. The provider lookup we talked about, we have data right now from Molina and Select Health, so you'll be able to at least go in, put in a doctor's name or a facility's name, and it will tell you who they are with between Molina and Select Health. We are in the process of trying to work with other carriers to get that data. Our long-term goal is to build a all-inclusive provider search. Some providers are a little bit stingy with that data, but we're going to do what we can to get as much in there going forward. And then if you need to update any of your contact information, so perhaps you've rebranded yourself to a different company name, perhaps you've changed your contact phone number or email for your insurance business, just let us know and we'll update it and get it changed accordingly. Placemat coming soon. So we actually have a beta version reviewing today, and then hopefully sending out to the printer tonight, and then we'll have them up and soon. They can be picked up here at the Health First office, or I'm going to be out on the road delivering them the day after or the day of that they get printed, that we pick them up. Green Line is going to be running all open enrollment. If you called last year, hopefully you enjoyed our radio mix. Call, text us 801-889-1997. You can email us at thegreenline@hfrocks.com as well. You can also regular mail it to us, but my only requirement is it has to be handwritten and you have to get at least one cramp. So, final preparations, healthcare.gov certifications have to be done in order to be eligible to sell plans and receive commissions for plan year 2021. A lot of you have done them. There are some people that haven't, but we'll send out that link if you have questions about it. Once again, call or text the Green Line. We'll walk you through it. Carrier contracting, it's going to be very important to be appointed with everybody this year. It's not going to be so cut and dry as it was in past years where we, just had people signing up for Select Health over and over. There's going to be a lot of change-ups with the diabetic care plan, the Molina Zero Bronze, Zero Premium plan. Just across the board, we just want to make sure that you are contracted with everybody and that you have the ability to sell what makes the most sense for your client. So Brandon will be kind of auditing and sending out contracting paperwork for that. But set up a plan, process, and execute. Start preparing now to contact your clients to update their information. You're going to have a quoting tool on Monday, and you're going to be able to start cranking out quotes. Hopefully you'll be able to churn through a portion of your book and have just stacks of enrollments ready to go November 1st and start marketing today if you want. So spend a lot of time this year putting together marketing materials for you to drive awareness leading up to open enrollment, and then to drive referrals from your existing client base throughout open enrollment. So we're gonna put some of these up on the screen and kind of show you. We've got posters, we've got flyers, we've got videos. We're making some, we call them slide deck videos, and really these were all designed to be shared via social media. So share it on your Facebook, Instagram, Twitter. As you take care of clients, get them to share it on their Facebook, Instagram, Twitter. It's going to be a great year for a social media advertising campaign. With the COVID-19 crisis, a lot of people just staying at home, scrolling the internet. Plus, that's the way the world's kind of going. Anyways, the flyers specifically are going to be interactive. So I'm going to put a video up here on the screen, but it will have interactive links. Your clients can download it to their phone, send it to their friends. They can download it on their phone. When they click on the logo, it'll launch to your website. When they click on the phone dialer, it'll bring up, or the phone number, it'll bring up the phone dialer. When they click on the email, it'll bring up their mail client with a message to you that they just need to fill out. So really cool stuff there. And then we're going to show you one of the videos. You can order one of these and we will tailor the end of it so that it'll have your logo and your contact information. If your mind isn't currently worried about health insurance, it may soon be. The annual open enrollment period to shop and apply for health insurance for the following year is rapidly approaching. Let's take a minute to talk about some of the options you may qualify for to help save money on your healthcare. Specifically, we want to talk about cost-sharing reductions and the advanced premium tax credit, more commonly known as a subsidy. It's important to understand that a cost-sharing reduction is not the same as a subsidy. They are actually two completely different things. A cost-sharing reduction helps you save the money you spend out of pocket on things like doctor's visits or prescription drugs by enhancing your insurance plan's benefits. A subsidy, on the other hand, helps lower the cost of your monthly payment to your insurance carrier. Applicants that qualify for a cost-sharing reduction will also qualify for the subsidy as well and can apply both to their insurance plan. While the marketplace offers many plans categorized by metal level, the cost-sharing reduction is only applicable when you choose a silver plan through the marketplace. In order to qualify for either a cost-sharing reduction or a subsidy, you must be a U.S. citizen or legal resident, must not qualify for employer or government insurance programs, and must meet certain income requirements for your household size. As a general rule of thumb, lower income means more savings. If you are interested in saving money on your health insurance, the most efficient and hassle-free way to determine what you may qualify for is to work with an independent, licensed insurance broker right here in the state of Utah. We work for you as the client and not the insurance companies. We are local and familiar with each of the Utah insurance carriers, their plan options, and provider networks. Our services are also 100% free for you to use. Begin your journey towards a better health insurance experience by contacting me, your community's personal insurance broker, today. But this was something else that Dan and I kind of talked about. So most of the carriers reported their enrollments facilitated by brokers, right? So pretty much all the major carriers reported 50% or less of their enrollments were facilitated by brokers. Cigna was the highest, right? They said 60% of their enrollments were facilitated by brokers. What this comes down to, based on data and enrollment figures in the state of Utah, Dan pretty much told me there's about 100,000 plus lives left in the state of Utah that are enrolled on the marketplace. They're using the marketplace, they're going through healthcare.gov, but they aren't using a broker. There's 100,000 plus lives left to claim that aren't working with a broker. And so it's a fantastic year to market and try to get out there and capture some of those people. So you'll find new clients coming off of employer plans, lost coverage due to COVID, a lot of those things kind of going on, but there still is a chunk of clients out there that probably aren't doing their health insurance well, not getting the right subsidy. You know, they're in the wrong cost sharing tier. They picked the wrong plan because there's 51 different plans and they don't know which one actually benefits them the best. But there's 100,000 plus lives out there that could benefit from the expertise of a broker. And then final thoughts, Brandon, as we embark on 2021 open enrollment.
Final thoughts that we have are we need to make sure as agents that we are not auto re-enrolling our clients. We usually harp on this every year, and every year it's a different reason as to why. This year there are many reasons. We need to make sure we're not auto re-enrolling because the Medicaid expansion, people getting kicked to Medicaid if they're auto-enrolled. There's a lot of plans that are being discontinued and getting crosswalked to different plans that don't really make sense. So we need to make sure that they're not auto re-enrolling to a different plan. Select value moving into those 4 counties in particular. If anyone gets auto re-enrolled onto a select value plan, onto a select med plan in which the value network has entered, their plan may go from $30 or $40 a month to $200 or $300 a month. So there are a lot of reasons to not do that. Please do not do that this year. There's going to be a lot more work involved this year, but as we've seen in years past, disruption equals opportunity. It's another one of those years. This is a great year to diversify your book. In years past, we've always said to do this, but it's been hard to because, Select Health has monopolized the market, right? And it's only been them and the University of Utah. And as the University of Utah's premiums continue to rise every single year, it puts Select Health controlling the majority of our book of business and your book of business. So please diversify your book this year. Molina's Bronze Plan, I would expect that of our Select Health book of business, I would expect 30 to 40% of your book of business to be moving to Molina or Cigna this year from Select Health, especially with Molina having such a significant network and such competitive plans and premiums across the board. So make sure that you're looking at other carriers. Make sure that you're diversifying your book. We don't want all of our eggs in one basket. We also...
Well, I was going to butt in real quick, sorry, on the Molina Bronze. One of the other final thoughts would be get familiar with National General supplements. We've had agents in the past where last year, for instance, they sold a lot of the 8150 Bronze because of all the pre-deductible copays, but it was a high deductible plan, and so they partnered it with these supplements, and basically they built a better Bronze plan than selling their client the 73% cost sharing silver plan that was pretty expensive. So with Molina, with this zero deductible, possibly zero premium Bronze plan, this is going to be the groundwork that you're going to build a better Bronze plan on using these Nat Gen supplements.
Exactly. Exactly. Please take advantage of David's hard work in those marketing materials. Start marketing to your clients. Use social media. Reach out to your current clients. Let's get a huge head start on open enrollment. Please call, text, email us if you need anything. Go to the website, hfrocks.com/products. Make sure you order your marketing materials. So start marketing and reaching out to your current book of business. Let's make sure that we get a head start on open enrollment for 2021. And good luck. Please let us know if you need anything at all whatsoever. Thank you so much for being a part of Health First. We love what we do, and we love you as agents, and we're so excited for this year. Take care.